Hello, everyone. I'm going to be talking about Native Americans and the lack of access to healthcare. When I say Native Americans, I am not talking about one specific tribal group. I'm talking about Native Americans in general, and they come from a variety of different tribal locations and reservations. So yeah. So we found through our research that many Native Americans face barriers when accessing healthcare. This includes language barriers, educational barriers, and um, discrimination they face throughout the healthcare system is incredibly hard for them to deal with, and it leads them to not want to come back to receive healthcare. And a lot of the times, the elders are the ones who have the most PTSD from receiving healthcare, and so this is important to understand, at least for me when I researched this. Is I think that in general, I think that we perceive elders to be a certain way, but they have been through so much. The Native Americans elders have been through so much in their lives, and they've have been traumatized through our society and just through our healthcare group, healthcare um, system. I apologize, due to certain systematic racism, and um, it's unfortunate that we're not able to help them out, but fortunately, hopefully in the future, we will be able to think of some interventions to help them. We found through our research that only 43.5% of American urban Alaskan Natives and urban American Indians have healthcare access, and this is because only federally recognized tribes are eligible for services within they offer within certain tribal locations. Um, so just to briefly go over these two pictures, I really liked them. I think it's good to provide a picture of kind of what's going on within their group. So this is a screenshot from Peter Pan, and it shows a Native American going into a pipe and wearing a feather hat. And the media or this movie portrayed them a specific way, and not, and society reflected that. And a lot of people, when they saw this movie, instinctively thought, "Oh, this is how Native Americans are." And I'm not saying all adults thought that, but if you're a kid watching it, I know when I first watched it and I saw this movie, I saw them perceived a certain way, and a lot of my friends and other people I talked to perceived Native Americans to be this way. I mean, some of the friends that I used to go to high school with used to wear these hats because they thought that's what Native Americans would wear, and so I think that understanding that the media will oftentimes play a role in how a population is reflected is important. And then up here is just a chart going over the different health disparities that Native Americans may face throughout their lives. And as you can see, they face a lot more health disparities than whites do. Just to go over some statistical information, the American Health Program is responsible for providing access to medical care, dental care, and preventative health education for approximately 25,000. In 2006 to 2007, over 100,000 healthcare visits were provided in the nation's clinic. Um, so just to further go over some statistical information, within rural areas, only 19.1% of American Indians and Alaskan Natives are unable to access primary health care. Oral health, considered the most important, at the top of the list was 62.2%. In Jessica Liddell's and Amy Stiffarm's article, they reference this a lot, and they reference that a lot of elders actually do have oral health problems because they refuse to go back to the Western healthcare to receive help because of the experiences they've had previously. 68.16 thought the cost of dental care was a barrier, and 51.74 thought the wait times at the clinic was a barrier. Additionally, 2.56 million American Indians and Alaskan Natives are covered by IHS. There was a study that studied the difference between American Indians and Alaskan Natives and urban and Hispanic whites, difference in healthcare. The study's population size consisted of over 7,000, with ages 18 to 85, 7,000 representing urban and Hispanic whites, 70 represented urban American Indians and urban Alaskan Natives from the Northeast, and they asked about religion, race, and demographics, and the results showed that urban and Hispanic whites have better quality healthcare than urban American Indians and urban American Alaskan Natives. So with IHS limited funding for 25,000, communities are coming together to help provide care to those not covered by IHS. As referenced earlier, media often portrays a culture group a certain way, and as a result, society will reflect that. And this can make American or Native Americans feel inadequate about their own possibilities in their own community. And less than 1% of children's cartoons are Native American. So just to go into more to talk about who we interviewed and why, we interviewed Anastasia Benedict, who was a program coordinator from St. Regis Mohawk Tribe in upstate New York. Although she doesn't specifically work in healthcare, I thought that having her viewpoint is important, specifically because she has been working in the St. Regis Mohawk tribe for a very long time, so she knows how everything works. And she's aware of different complexities in the tribe's locations, and so I thought adding her was incredibly important. We also talked to a school social worker that works in the Native American Education Program in North Syracuse City School District. I thought having her was important, and I think it helped that she worked directly with the population, specifically with their education. And I think that having a social worker's input is incredibly important, especially when we're talking about patterns of racial disparities, as we are talking about different racial experiences that Native Americans may face within the healthcare system. Although she doesn't work within the healthcare system, again, I think her input is still important because of her experience with the tribal group, and she sees different experiences they go through. So just to sum up the main points, so when I'm talking to Anastasia Benedict, the program coordinator, I asked about if they received discrimination while receiving services. She indicated that when they receive services outside of the reservation, yes, they do. And most do not receive any services. They're not a part of the federally recognized tribe, which I mentioned earlier. I asked about efforts of inclusion. She mentions that there are more efforts to make more things more inclusive, with trainings being offered more, and the language barrier has been getting better, and there's more effort to make people more comfortable. And one of the main points that she wanted to add, or that she talked about very passionately, was that she felt that when asked if she felt like Native Americans are being properly represented, she said no. She feels that Native Americans are not being properly represented, and the truth is being suppressed by the government. I know personally, before this topic, I didn't know anything about the Native American culture. We didn't really learn anything about that in high school. We weren't given the opportunity, and so I don't know if this is true or not. I just know that from my experience, this is not something we learned about. So we then interviewed a school social worker that works in the Native American Education Program in North Syracuse City School District. When asked about healthcare, she said one time, even in the nation, a parent told her that they would get better health if they had a secondary health insurance. She talked about mental health, and she mentioned that there seems to be a long wait list. And the main points that she kind of drove home was that she felt like that the students that she serves are constantly being misunderstood, and because of the areas that they come from, the disadvantaged areas they come from, they oftentimes are being labeled as one way. And she feels that with her work from the Native American Education Program, that she is doing the best that she can to help out these individuals in order to work towards helping them in the future. So I'm going to use these two books to help connect things. So throughout our research, we were able to find evidence of discrimination within the institution, otherwise known as institutional racism, which is occurring in Western healthcare and also other places as well. This is just with my topic. In McNamie's book, The Meritocracy Myth, he specifically goes into detail about the facts that institutional racism does have more consequences than other forms of race, than other forms of racism. Not to say that other forms of racism don't have consequences, but he did make sure to outline that institutional racism, along with other forms of racism, do have consequences more than other forms of racism. So they're grouped into one specific group, and this helps to explain why people aren't coming back after they receive negative experiences within these locations. So in Jessica Liddell's and Amy Stiffarn's article, which I referenced a couple times, they specifically talk about how there was an instance where the man, he kept telling them something was wrong, and he kept being dismissed and being talked down to and being degraded, and eventually he died. But there was many people cited within their article that mentioned that because of the negative experience that they had, they weren't going back. Specifically, elders, Native Americans felt that they received horrible care, they had PTSD from their experience, and they didn't want to go back. And so learning about the institutional racism helped help me understand the form of racism that is most affecting this specific population, and it helps me further strengthen my main points. So in the Meaning of Difference textbook, the author talks about how there seems to be a call back to nativism and harkening back to the Native American lifestyle. This is specifically related to information regarding how the population is handling their own discrimination, specifically in the article entitled Alternative Medicine, a Culturally Centered Approach to Managing Chronic Pain from a Native American Community. The author goes into detail about how, like the textbook, The Meaning of Difference stated, that there seems to be a callback to the Native American lifestyle tradition, the Native American lifestyle. In the article, they mentioned that this is because of discrimination they face within healthcare. There also be different things going on, but reading that fact in the Meaning of Difference textbook helped me understand that there seems to be an overarching theme going on in Native American societies today that's harkening them back to traditional lifestyle. So reading the book, The Meaning of Difference textbook helped me understand and further cement my point about how this seems to be a theme. McNamee once again talks about cloaked racism, microaggression, which is in our daily lives. Some simple phrases without thinking, and without thinking you're being discriminatory towards a group of people. And the interview that I did with the project coordinator, she indicated that how people mistakenly will say that Native Americans live in teepees, they ride horses, and sometimes they say this to their faces. Sometimes you hear about that online, and these instances are microaggressions towards the specific group of people, specifically if they say it to their faces or even just under your breath. These are forms of racism. These are forms of microaggression. You're saying things under your breath, and this concept that McNamee described helped describe the types of microaggression, the types of racism that this specific culture group is also facing. So I just want to go over some interventions and gaps and ideas for the future. So throughout my research, I was able to find an intervention to students' overall awareness of Native American culture. So one of the interventions that I used through my paper, I apologize, was culturally responsive teaching. So in an example of this would be the Adneen Dush program, which specifically is a science development program which focuses on student-centered activities influencing certain Ajabi cultural themes. The results were positive and showed that as long as students were in a positive environment, it increases emotional support and productivity and instructional learning. I think that while culturally responsive teaching, I think it can be hard implementing it, especially if you're going to deal with teachers that don't necessarily want to learn about different cultures or want to implement that into a lesson plan. I think that in the long run, I think this would benefit a large group of people, and I think this is something that I really supported in my paper. And I think this is an excellent idea. Another idea that I had, because of the discrimination that they face in the healthcare field and because of the different discrimination they face in the healthcare, I thought of doing more of a skills training lab for healthcare representatives to learn more about their specific cultural group. And I think that this is a great idea. And I do see some pitfalls in service, specifically funding issues and just overall desire for people to want to learn more. I think this would be an issue, but I think that in general, I think building that trust in the healthcare system is something that we should be focusing on. Another intervention technique that I think is important is focusing on community level organizations, focusing on working within your community. So whether that may be working within your community to offer vehicular assistance. When I say within the community, I'm talking about within Native American communities. So working within the communities to find assistance with vehicle support, trying to find grants that will offer them financial assistance, because I've referenced earlier, sometimes they have certain, or everyone within the healthcare system, they have, if they don't have coverage specifically, they will have certain financial issues, especially if they're not having direct coverage within the healthcare system. And so working towards that, finding those community level organizations is incredibly important. I think I don't see any issues with service delivery within this specific intervention technique. I do think that there's different community level organizational researches going on right now, specifically when the IRINAH study, specifically under the Thrive and Too Well study. The Thrive study brings whole foods to the tribes, and it's more of a community level organization. And the Thrive study, which is based on the IRINAH study, it's based on evidence-based material from that study, which proved to show that doing stuff like providing the community with whole foods would be important. And so I think doing something like that, by doing something that will help the community out, offering them something, would be something that was beneficial. And the only issue that I see with that, offering some more community level organizations help, would be finding either volunteers or time to do this would be an issue. And overall, finding organizational techniques to work on finding the main goals for those community level organizations, because there's a lot of different issues and disparities going on within Native American places. And so working on trying to find certain monetary, vehicular, and support for these populations through community level organizations is important. So in the future, research should be focused on monetary, financial, and vehicular support. There are a lot of gaps in the research. Specifically, a lot of the research, there was very little research for interventions available for Native Americans in the healthcare system. And I hope everyone enjoyed listening to me talk.